the clinical judgment areas. Right, so that's our agenda for about 30 more minutes. Just really quick, some key tips on passing. So if you have taken the NCLEX before, you in I know some students have been having trouble getting their report. So if you're not able to get your report, then it's best to just do that pre-test and look to see what was your weakness and start there. You want to start with your weaker area first, and that's what I usually do with everyone. If you um, have your report and you're able to look through it, you want to understand that report and use those outlines to study. NCLEX is a selfish exam. If you heard what she mentioned, that she didn't want to tell anybody, she, you know, things that she was doing, she was having to focus in on the questions and study on the train or wherever. So sometimes you have to do that. You have to make the most of your time and make NCLEX your priority, which may be different from school. A lot of us maybe went through school. School might have been a little easier, but you get to this test, and this is a generalized national exam. And the main thing they're trying to see is if you're going to be safe as an entry level nurse. That's all they're wanting to know. Is she safe? Because with all the news and nursing nowadays, they want to make sure we're not going to jeopardize our license by harming a patient, hurting a patient, that we do all the checks, that we recognize cues and recognize things that could be going wrong, that we know when to report something, that we know the first thing we should be doing when a patient is going bad on us. So you want to be able to understand nursing content, concepts, study one category at a time. That's why every week I say focus on management. This week we're going to focus on farm or whatever category you're on. Um, at the very least, and I follow other tutors, at the very least, you want to do 5 to 25 questions. I follow this tutor, Dr. Shelley. I like a lot of her tips. Some tips I don't agree with, but some I do. And she's big on UWorld. I like UWorld. I'm not the biggest fan of it, but the content, and I use some of their questions and some of their rationales, because they do break it down. They tell you by the book, this is what it is. But none of those Q banks give you strategies. And that's what makes it a little bit harder, that you can get all those UWorld questions right. And it says, hey, you're ready for the exam. Then you get to the test. And it's like, wait a minute, UWorld said I was ready, but I got to the test and I didn't pass. So you want to take 5 to 25 questions at least. I like to do 30 to 50 a day, and review the answers, review the rationales, look at your testing strategies. And that's one big part of it. You want to look at those questions, especially the ones you're missing, and say, now, how could I have strategized through that? Was it a priority question? Was it a nursing action question? And you want to understand and answer your case studies. You want to go through those as well. So those are 5 tips. Um, to be successful, it takes time. This test takes time. It's a different type of exam. It's going to be different from any exam that you have taken in life. You have to be focused. It does take hard work, and you do need a strong foundation in content, A and P, and path. Though that just helps pull everything together. But that they're wanting to see, can you critical think your way through an answer, no matter what comes up, because in real life, things that we never thought could happen may happen. Well, what do we need to do? So that's what they're testing you on. Um, you want to focus on specifics. If at anything, just look at the questions that you're doing, and when you're getting questions wrong, use it at your as your guide to study. Go back and look at that content. Focus on specifics. What were some key words in the question? What were some details? And what were the important information that maybe we missed, trying to answer that question? And then don't forget your testing strategies. Don't lay those testing strategies aside, because the majority of the students I have that pass, they either say, I used the strategies, I heard your voice during the exam. I had a student tell me that, I heard your voice saying, use your comparable and alike. What's the nursing action? What are the 3 ways you prioritize? So you want to change the way you think, and you want to think like the NCLEX nurse, right? By the book. When you're seeing questions and they give you those rationales, what was their thinking and what was your thinking? I compare that. Oh, I thought it was this, but here they're explaining to me this is the reason why this is the answer. So you got to change your way of thinking. You got to keep an open mind and be positive. Don't be so hard on yourself if you're getting questions wrong. Utilize those incorrect questions as a way to get stronger and get better, and to know what things you need to improve on. NCLEX has its own language. It's a language that you have to understand. Certain words, certain terminology means certain things. And like she said, they'll throw in a word to see, did you catch that? Did you pay attention to that one word that might make a difference in how you should answer that question? That is what will help you pass and answer the question correctly. You want to focus in on your process of elimination. And by eliminating, that will help you get down to the right answer. I always tell people, go with what you know, go with your gut feeling. Don't second guess yourself. All right. So with management, this is the NCSBN outline for the NCLEX RN. We're going to look at coordinated care. It compares to coordinated care with, for my LPN students, I have a few on tonight. And for RN, it's safe. Everything is about safe and effective care. So as the RN, you're promoting achievement of the client outcomes. You're providing and directing nursing care. You're enhancing the care delivery setting. You're protecting your patients and you're protecting other people you're working with. You're providing direct nursing care. You're enhancing the care delivery setting to protect the patient and healthcare personnel. All of that sounds like safety to me. Protecting. They honk on that. Um, so this outline is probably one of the longest outlines. And for management of care, they took away a couple of percentage on it on the test now than they did where the way it was laid out before April. It's now 18%, but it's still the highest percentage. For LPN students, you're providing nursing care, you're contributing to the enhancement of the healthcare delivery setting. And again, there's protecting. You're protecting the patient and healthcare personnel. You're doing the same thing. You're just collaborating and you're working up under the RN. You're working with the RN, but you're still overseeing other nurses. You're still overseeing UAPs, and you're collaborating with the healthcare team members to facilitate effective patient care. So very similar outlines with coordination. It is still your highest part of the distribution of the test plan. It's 21%. And that's the average. All right, don't overlook those testing strategies. All right. Now, this testing strategies is not something you can do overnight. It's not something you're going to get in one day or one week, but every day you practice questions, you want to keep those strategies in mind. Look back at them and compare it to the questions you're getting and make sure you're utilizing the strategy. Let's see. I think we're going to do a question on some of these. I'll probably leave there for you for next time or just send them to you and you can practice. Okay, so this is a coordinated care question. I think I underlined some key things that just kind of stood out. All right, so read through that question, and I want you to think about. Oh, I gotta plug up my battery here. I want you to think about what things could you eliminate. Use your process of elimination. And I'm just gonna plug up my computer before it goes dead. Okay, any thoughts on elimination, process of elimination? Any options you want to get rid of? Okay, so A, calling the family to come sit with the patient. Yes. And eliminate C and D. All right, good. Okay, so we're going to get rid of A. All right, so A is saying call the family. And 9 times out of 10, if you're calling the family, they're not staff. And usually that's a sign that that's probably not the good choice. Here they're saying we're being the role of a client advocate that is on the management of care and coordinated care outline, and we're trying to figure out what is our best demonstration of that role as a nurse. Patient is our case event was the patient has osteosarcoma, so they have a type of bone cancer, severe pain. They're getting oxycodone 5 milligrams, and now they're reporting that the pain is 8 out of 10. So it doesn't seem to be very well controlled. All right, so we're getting rid of A because family really is not a part of us being a patient advocate. Just having them sit with the client doesn't take care of the pain. And notice this is a nursing action question. Nursing actions will do one of two things. You're either trying to keep the patient safe, fix a problem, and the problem here is they're in pain still, even though they just took a pain med pill 1 hour ago, or you're trying to do something that helps the patient. So although family is good support, they're not going to help. They won't be able to help them with this pain issue. All right, let's look at C, suggested guided imagery as an adjunctive treatment approach. All right, so if we suggest guided imagery, let's go back to our facts. Is that a way to advocate for your patient? So possibly, right? Imagery is good, but he's in a pain 8 out of 10. And suggesting he does that fix the problem? Does it help the patient? And it's hard to say because he has bone cancer and this is severe pain, 8 out of 10. That's something that he can use in adjunction to taking his pain medicine. But an 8 out of 10 pain is still severe pain. We need something else to really help him. Very good. So that's a good choice to get rid of. All right. And I see that you're saying D. Get rid of D. Ask the client if they have tried complementary therapies. Anything similar with D? Do you see any similarities with D with any other option or any of the options that are similar? Because right away, yes, very, very good. C and D are similar. So right away, we see comparable and alike options. 9 times out of 10, if you're thinking one of those answers may be right because they sound kind of good, try complementary therapies. Well, guided imagery is a complementary therapy. So if I didn't know that and I didn't use that testing strategy, I might go with C or D because that sounds like it sounds like it's a nursing thing to do and it's a nursing intervention. It's something we can do without a doctor's order because most of the time NCLEX wants you to answer it using a nursing intervention. And a lot of times we stay away from let the doctor know because they taught us in nursing school something you can do before you notify the doctor. But you may see this option more often than not. And I noticed those type of questions are popping up more because when they did the last analysis, they found one of the things that was in the analysis for nursing is that entry level nurses didn't know when to call the doctor. They were trying to fix problems that were just not nursing fixable. They didn't know when they could call a doctor or when they should do something nursing first and then call. So that's a good choice to get rid of. Very good. All right, and that leaves you with B. So you see by just using your clinical reasoning that we should really notify the healthcare provider that his treatment is ineffective, that he's getting his pain medicine. He got in an hour ago. His pain is still. There we go. Okay, you can hear me. Sorry, my computer went dead. They said, "Are you still on?" I'm on. I'm still here. All right. It went dead on me. I think I just still didn't have it all the way plugged in. That happens when you're not feeling great. You overlook things. I'm overlooking things because I'm still kind of. I got to take some medicine tonight. Hopefully, I'll be feeling better. All right. So let me go back. We're still recording. All right. So very good. If you said to eliminate A, C, and D, you're absolutely right because B is our answer. Great job. Great job. All right. So, most patients with metastatic bone disease. So, now once you get that question, if you got it wrong or if you got it right, this is what you're going to do. You go back and you make your notes. Some people like note cards. I noticed she mentioned that she didn't like doing a lot of the note cards, but you want to pull away from that content and information and your testing strategy. So you got your number one testing strategy out of that, which is comparable and alike options. Then you want to review the content. The content was metastatic bone disease, osteosarcoma. They're going to have severe pain, moderate to severe bone pain. Now, the other strategy to this was a nursing action, and how can I be a role? How can I be a patient advocate? And sometimes there may be times where we have to let the provider know. All right. Oxycodone should be given every 6 hours PRN. It is a immediate release opioid agonist. But if they can get a scheduled PO med instead of a PRN breakthrough med, usually they get both. They need something scheduled that they get around the clock every 6 hours or every 4 hours, and then in between they can get the PRN med. The nurse assesses for decreased pain. Excuse me, the nurse will best advocate for more effective pain by notifying the provider that the opioid medication is not being effective. And I think they were getting it, they didn't say whether it was PRN or not, but just keep that in mind that scheduled pain med usually lasts longer. PRN is breakthrough. All right. So one thing about studying that, if I was just studying that in the book about bone cancer, and I don't have a visual or an example of somebody dealing with bone cancer and what kind of question I would have on that, then it may be hard to visualize that situation and have an example of how I should answer that. Multimodal approaches. So those are your non-pharmacological therapies. They do like us to choose that as nursing interventions. However, in this case, we have to combine it with the correct pharmacological intervention. So the first intervention is going to be, in this case, is to notify the doctor, because they are likely to either change the med, increase the dose, or do something that will help control their pain a little bit better. All right, great job. Patient advocacy. All right, I had planned to do this question, but we may have to go forward because I want to. So I'll send you a copy of all this. This is a good chart to have, and if you've already done management of care with me, you probably have a copy of this. In management of care, they present a lot of patient problems to you, and you're trying to figure out how to fix that problem. How should you help this patient? How can you keep that patient safe? That's a lot of management. We saw in the outline, it's talked about protecting. So minor problems go directly to the person. Legal problems are things that may need further investigation. You, as the bedside nurse, are not investigating. So that goes to the manager or the supervisor or your charge nurse, whoever's next in line. If you've done all you can do and you call the doctor about a situation and they didn't fix the problem, then I would go to my manager. I would go to the charge nurse and find out what should I do next, because the problem didn't get fixed. They disagree with what I said. I'm still not comfortable. What goes next? If it's a patient harm problem, fix the problem first, right? Make sure the patient is okay. They're your priority. Assess the problem, assess the patient, then let the doctor know and fill out the incident report, especially if they fail or something was happening that should not have been. All right. Any questions so far? All right. So we're going to look at one of the cognitive skills, processes, and descriptions. So on your NCSBN report, if you've taken it before, they kind of outline what these are. And for the most part, I do see that a lot of people do get above on this category or near. Every now and then I see some below, but usually I see majority of people are above or near. So people do pretty good on this. Um, Basically, this is a step of the nursing process per the NCJMM cognitive skill. And what that means is, um, it's a clinical judgment measurement model. It stands for the N stands for the NCSBN, who make the tests, and the C and the JMM stands for Clinical Judgment Measurement Model, and it's basically their framework. It's a framework for valid measurement that a measurement of how you're able to clinically judge and decide on what to do, or decide on maybe how to interpret the data, or how to respond, or how to reason through a situation. So we're going to look at the first one, which is recognizing cues. All right. Recognizing cues is basically assessment. It's being able to identify significant data in a case event. The data can be from all kind of sources. It can be objective data. Objective data is going to be your vital signs. It's things that you observe, medical history, things that I can read, things that I can assess on my own. That's your objective data. Your subjective data comes from your patient. I don't know if the patient has a headache unless they tell me. So, as a nurse, you're going to recognize cues by identifying significant data from many sources. Now, these types of questions are going to address the process of gathering that data, whatever's relative to the patient in the question, confirm the data, and then you need to communicate that data and possibly document the data. Keep in mind, documentation means the end. It means that there's nothing else I need to do. Either everything was normal, or I have done and reported everything I need to do. Usually you'll see that in select all that apply. They'll say, I need to do all these things to help the patient. And they'll say in document, yes, I'm going to document everything. But it's usually not the answer. Like if there's just one answer, usually document is, unless everything is normal, then yeah, I'll just document that their vitals are normal. So assessment and recognizing cues is usually the first step. It's the first step of the nursing process. So if you're asked to select your first nursing action, your immediate or your initial nursing action, you want to assess and recognize cues to prioritize when you're selecting the correct option. So you're going to look for strategic words. Now, strategic words, sometimes it takes a minute to be able to recognize these, and these come out of Saunders. But strategic words are words that tell you need to prioritize, or words that reflect an assessment. You want to be familiar with this, and as you're reading questions and going through questions, you want to pull out that and say, oh, it did say to check, it did say determine, it did say find out. That means assess. Other strategic words, all of these things down here are negatives. These are usually in your question. Need further teaching, need follow up, need further education. And then these are priority. All right, so those are some strategic words. The other things, if an option contains the concept of collection of client data, then the best choice is probably to select that option. Like, I need to get more information. If they're asking me for a nursing action, well, the first thing I'm going to do as a nursing action is usually assess. However, you got to make sure that assessment is appropriate. You don't want to pick something that's not relevant to what's happening to the patient. I would not assess the patient's toe if they tell me my head is hurting. I'm going to assess their blood pressure, or look for other things. What could be causing a headache? Is it increased intracranial pressure? What other things do I need to assess? So don't just pick assessment just because you see a trigger word that means assess. Possible exception to the guideline. There's always a rule, exceptions to the rule. If the question presents an emergency, then you have to read carefully and see, is this an emergency? If in an emergency situation, an action may be the priority. Like, I may need to do an intervention, like they're having trouble breathing, just go ahead and put the head of the bed up, put them on some oxygen. I may not have to assess further. But if they do say assess the pulse ox first, that might be appropriate to know what's going on with them. So it all depends on what options they give you. They may not give you the option you're looking for, so you got to go to the next best thing. All right. An action may be the priority rather than taking the time to collect further data. Do I need further data to know what to do for them, or can I just go ahead and do a nursing action to help the patient? All right, we're going to look at one more question. I hope this doesn't come up too blurry. I should have made it a little bit bigger. All right, so we're going to recognize some cues. So we got a patient who had an application of a right arm cast, complains of pain at the wrist, when the arm is passively moved. So as you're reading, I want you to pay attention to certain words, opposite words. I want you to know what that word passive means, because you can see passive or passively in a lot of different situations. They might tell you that someone needs to learn passively. Well, if I'm going to learn passively, I'm not putting any action to it. Maybe I think it's going to get into my brain by osmosis or something, but passive learning, you're actively involved in learning. You're hands on. You're doing the questions just like you do for NCLEX. Passive and active are opposites. Active range of motion, for instance, versus passive range of motion. So notice they say here we're passively moving the arm. So you might see that terminology. You want to make sure you understand what that means. So this is somebody just moving their arm, and they're not moving their arm themselves. Maybe the nurse is moving it. Based on the assessment findings, the nurse recognizes cues that indicate the need to take which action first. So, based upon the assessment finding was what? That the arm is passively moved and they're complaining of pain. So, we have a problem. And what should we do first? Which ones would you eliminate? All right, good. Someone always already said 4, so that means they must have eliminated everything else. All right, some says eliminate 2. I like eliminate 2 because we learned that document means it's the end of the story, right? So um, if you don't know that, you might go for that answer. So document equals end of the story. This isn't the end. I need to know why their arm is hurting, and I need to do something about it. So that's a good one to get rid of. And we know we're looking for something that can help the patient and fix the problem. Why? Because they say a nursing action. Indicate the need to take which action first. So one is fix the problem, help the patient, or fix the problem, help the patient, or safety, keep them safe. All right, very good. I think we got a lot that we have eliminated. Let's see, we eliminated 1, 2, 3. Very good. Elevate the arm. It may or may not help. We don't really know because I don't know why they're having pain. Document is the end. Giving them a pain medicine probably would help with the pain, but what do we need to do first? And really, all 3 of those, 1, 2, and 3, might help the patient, but what needs to be done first? So if you've eliminated 2 and 3, that's right. If you eliminated 1, very good. First, like you said, assess. Very good. Check is an assessment word. Check there, do a neurovascular assessment, paresthesia. Are you having any numbness or tingling? Can you wiggle your fingers? Can you move that arm? Paralysis of the right arm. Very good. You guys did great. So here are some. So now when you get a question like that, you want to make sure you don't let it pass you by. Because if you get another CAS question, you want to make sure you understand what do I need to do for anybody who has a CAS. Causes of neurovascular problems or compartment syndrome, swelling, numbness, fingers are turning blue. That means the cast may be too tight. Compartment syndrome is developing. So that could be the reason why they're having pain. You're also using the nursing process in um, the first action. That's a priority word, first. So nursing actions, fix the problem, help the patient. But keep in mind, do you need to assess more to know what is the problem? Do I need more assessment to know what to maybe tell the doctor? Keep the patient safe if there's a safety issue. 3 ways to prioritize: ABC, Maslow's, and ADPI. In this case, we use ADPI. I need to assess first. 9 times out of 10, if they're asking you for a nursing action or an intervention to do first, you probably do need to assess more, unless they give you enough assessment. So your goal as you're studying is to master the following: master the content of the question, review testing strategies and know your testing strategies and know how to see those strategic words and phrases. And you want to learn NCLEX language. What does it mean when they're saying someone's hurting and they got on a cast? What does it mean when they say passive versus active? What does it mean when they say you need to revise their care plan? That means there needs to be a change in the care plan because that patient is not exhibiting whatever they were doing or not doing in the previous plan. Maybe they've gotten better. All right, so we come to the end. We didn't get through all the questions, but that's great. That's okay because we had a special guest and some good motivation. I hope that has really helped you all tonight. So, some free things I want to mention since Black Friday is coming up next weekend and discounts. If you have anyone that you can refer to me, you will get a free 1 hour tutor session once they have a paid lesson with me. Um, and I will be doing a Black Friday question. If you can answer the question, you may either get a discount or a free lesson. So you do have to go in and become a member, sign up under my website, and you will be able to see under either the Spaces app, or if you need me to send you information on how to be a member under there, you just log in. You can make your own login, and you'll be able to see like blogs and stuff. I haven't done a lot of them early in the middle part of the year because I was working a contract. But some other things I have available is a study planner, study packets and notes. If you want to purchase a study session packet where you get either 8 sessions or 12, I haven't posted the 12 on here yet, but I do have it ready to go. If you want to do 12, you will get discounted. So if you're tutoring on Wyzant, you're getting charged extra fees, and the price is a lot higher. I can charge you about $10 less if you go through this route, and you eliminate Wyzant because they're like the middleman. They're getting a cut, and they're taking some for you and some from you and some from me. If you're RN or LPN, there's 8 tutor session packages, and you'll get the study packets. I think there's 6 or 8 packets. I have to load them up in a PDF and send them to you. I'm going to send some out. Some of you have already signed up, and I'm going to send those out on Monday. And then if you're interested, you can email me, or you can go on here and sign up. Now, if for just coming tonight, you will get an extra tutor session free if you sign up for a package. So if you do get a package, and I think it's 8 sessions, let's say you bought 8 sessions, you're already paying for 7, but you're getting 8. So you're already discounted there. Well, you'll get an extra. So now you'll get 9 sessions just for coming tonight. But let's say you're not quite ready. You're not quite ready to buy a whole package. Packages are ranging like 455 or so. But the good thing is that you can pay by Affirm, and I think PayPal credit is on there. But through Affirm, you can make weekly payments, or maybe every 2 weeks. They set it up for you. It doesn't affect your credit. You just pay them on a weekly basis, and it's like a plan. So let's say the plan is $30 or $40. That's a lot more affordable. Meanwhile, all your sessions are taken care of. You're done for the 8 weeks. But if you want, you can schedule it 2 sessions a week if you feel you need more. And usually I'll give you what I recommend. A lot of the last couple students, I meant to ask her how many sessions. I think she had 13 sessions with me. Sometimes we were studying twice a week. Towards the end, we kind of went down to like once a week or so. But the other 2 students that passed prior to her, one guy, he was like studying 3 days a week with me. But he was a anesthesia tech. So he was working, but he would study with me either early morning before he went into work, or sometimes after work. Sometimes he was at work with the computer in his scrubs, and I could see the central supply room or whatever he was in. So don't let that pass you by. That if you need tutoring, I'm doing all I can to just help you, because this is going to be your livelihood. This is really, really going to help you. And in your first year, you could potentially save up, $20,000. I can show you how to do that. I can show you how to be a millionaire by the time you um, get ready to retire as a nurse, because there's just so many opportunities. So there's a lot of opportunities. So I just want to make sure that you're set and that you are able to pass this test. It's going to change your life. The next webinar I put on here is going to be December 1st, 7 o'clock. So we're going to skip next weekend, and we're going to do farm, and I forgot what the other category is. Farm and this one, analyzing cues. So we're going to do that the following week. If you get a package, and if there's a paid webinar, you have access to it. You don't have to pay for any other webinar.